want to introduce myself. My name is DeSimio, and I'm a physical therapist, owner and operator of Tradewinds Physical Therapy. A little short history on myself. I've done this for 41 plus years. I wanted to do some videos to talk about other things than just showing you what this exercise is for this injury, what you do for this problem. I wanted to talk about what to expect with a number of different things. And today our topic, we're going to talk about what to expect with a total knee replacement. You usually have a total knee replacement for a variety of reasons. And I am certainly not a physician, much less an orthopedic surgeon. So I may not name all of the things in any sort of order that the reason you could have a knee replacement. Most times it's from wear and tear. What I tell people is mileage. Standing, walking, heavy physical activity, heavy sports, heavy weight training, jobs that are very physically demanding. Of course, then you can get it from the outlier kinds of problems where you may get it because you've had bone cancer. You may get it because of a car accident and you've had fractures. Sometimes you get it because of rheumatoid arthritis, which is a disease process that affects multiple joints. And so there's not just a reason to have it, there's multiple reasons that you might have a total knee replacement. The other thing to consider is there's also what's called a partial knee replacement or an Oxford replacement, which is essentially half of a knee replacement for only the worn part. The good news with that is if you just do a partial knee replacement, down the road, if that should fail, or the knee continues to give you trouble, or your activities are very high stress that continue, then you can go back and do a total knee replacement. So you have a couple of options. The differences that I see as a physical therapist is function, range of motion, and strength. With a partial knee replacement, you're going to get more range of motion. You'll get more of your movement back, where with a total knee replacement, you're going to lose some of your range. The normal knee should go from straight out here. In men, we should get 135 degrees range of motion. Most women may go 140 to 150, depending on how thin they are, how heavy they might be, how muscular they may be, those kinds of things. With a partial knee replacement, you're going to get from zero, which is straight out, back to probably 135-ish, maybe 140. It's a lot better than the total knee replacement, just because it's less hardware in the joint, and there's a variety of other things, but they're designed for somebody who's younger that will have more mobility or motion. A total knee replacement, which is exactly what it sounds like, they essentially replace all the moving parts. We'll talk more about that. But those range of motions will get you from 0 to 120. That's what they're engineered to do. You can go a little bit further, but most people don't use it, don't need it, etc. The thing to remember, you have to have at least 110 degrees to get up and down steps, up and down curbs, in and out of cars, those kinds of things. So with a knee replacement that's really designed to get 120 degrees, again from 0 to 120, to be able to function with normal daily life. Now, who might get one of these replacements? It does vary. Most times, most orthopedic surgeons that I've dealt with, they want to put it off as long as possible, because the 10,000 years ago when I started therapy, when they did knee replacements, they didn't understand that part of the motion of the knee was rotation. It didn't just bend and straighten. When it got to the end, it rotated. So the first, and I don't know the number of years, the first ones they came out with didn't have that rotational component, so they would work loose over time. The knee replacements now will go 20 to 30 years depending on your activity. So you want to put it off as long as you can. Now, sometimes you don't have a choice. Again, back to the car accident victim, slip and fall where you have fractures, sometimes bony disorders, those kinds of things. And again, there's other reasons, but you want to put it off as long as you can, because when we get older, we're not as active. The total knee replacement works really well for that. Somebody who's younger, the partial works better. But there's really not an age specific. I've had people as young as their 20s get it. I had a couple of people that had different sorts of cancers. They needed joint replacement in their 20s because the disease process affected that. So you're usually going to get them as you're older. When I'm talking older, 50 and older, the older or the longer you wait, the better, provided you don't have other complications. I may take a little bit of change of direction. I don't care what the commercials tell you, a total knee replacement is not designed to go back to high impact or stop and go sports. Rock climbing is out, bicycling is great, running is not a good idea. You know, things that you see on the commercials now with people doing box jumps, absolutely not. That is not what this knee is designed to do, so I don't want you to have any misconceptions about that. So there are some limitations with that.